Pets are a valuable part of our lives, but sometimes they might get too excited or too aggressive and end up scratching or biting someone. This can put people at risk of developing rabies, a virus that is usually transmitted by the bite of an infected animal. It's increasingly common here in the country today. But the good news is it can be prevented with just a few precautions. On the program today, we'll talk more about the disease, the different animals that can carry it, and what you need to do if bitten by one. I'm Dr. Freddy Gomez, and you're watching MedTalk Health Talk on CNN Philippines. A bite by a rabid animal can be highly fatal, but it's easily preventable. Our guests are here today to tell us how we can best protect ourselves from rabies in a country where it's extremely rampant. With us today is Dr. Jennifer Manzano. She's an adult neurologist from the Asian Hospital and Medical Center. Also with us is Dr. Camille Macalalag Santa Cruz, who is an emergency medicine specialist from the Rizal Medical Center in Pasig City and the Asian Hospital and Medical Center. Now, we have one of the highest prevalence of rabies in the entire world. The Philippines actually records over 200 deaths every year because of it. But outside of Asia and Africa, this disease is considered rare. Dr. Jen, I'll start the discussion with you. Why is it so rampant and widespread here in the Philippines?
We have a lot of animals that are strays. We are an agricultural country, and so we are very exposed to wildlife. After all, rabies is seen in animals and get transmitted to humans. So I think these are the reasons why it is more rampant in the Philippines compared to other parts of the world.
Now, the first step we need to take in order to take control of this rabies situation is better awareness of the disease. Dr. Camille, tell us what exactly is the rabies virus and, of course, especially how is it transmitted? Which animals transmits this?
Rabies virus or rabies is a fatal but preventable disease. It is caused by a virus and may dalawang ways to get infected. Either you are bitten by a rabid animal or you are non-bite naman yung exposure. Like you get scratched or you get an abrasion from exposure or playing with your pet, or you have an open wound that's been licked by an infected animal. So those are the ways by which you get infected. What animals are usually infected by rabies? Usually, they're seen lang sa mammals. Ang mammals, they are warm-blooded animals that have fur. So anything from dogs, cats, domesticated and non-domesticated, like big animals or large animals like cattle, horses. Some pigs have been documented also to get infected. In the wild, pwedeng magkaroon ng rabies ang mga bats.
You said that it can be transmitted through a scratch. Can you define what a scratch is? A lot of our viewers sometimes are very worried na kalmot sila ng pusa or ng aso. Walang dugo, but should they still go and have the rabies vaccine just to be safe?
Pag sinabi pong scratch or kalmot, it is basically caused by a sharp portion of the or a body part of the animal. Pwede kang ma-scratch by yung claws or yung paws ng animal ng alaga mo, yung kuko. Or pwede ring ngipin ang ginamit pero hindi siya bumaon, Ibig sabihin mababaw lang siya. Pero so mga mabababaw na sugat, or scratches or abrasions, pwedeng hindi mag-bleed. Pero we get a lot of patients at the ER pagdating sa amin, Doktora, pinadugo ko na po yan. So, alam mo yun, piniga ng piniga hanggang sa hindi na nga nagdudugo, dumugo pa lalo. So, ibig sabihin, napunit, nagkaroon ng tear dun sa where the scratch should have been. So, that actually makes it even worse. So, yan yung isang practice na ayaw sana natin gawin. Minsan may mga alaga tayo maharot. They're very playful, and you cannot control them. I mean, it's by nature, they use their claws or their paws. And if you get a scratch, agad-agad, wash with running water, use soap, no? Ang goal mo kasi is somehow ma-minimize yung risk mo of getting the virus, no? And saan ba nakikita yung virus? It is found usually excreted in the saliva of an infected animal. Ang aso, ang pusa, they lick themselves, no? When cats, they groom themselves, they use their tongue and lick their paws, the rest of the fur, etc., no? And for dogs naman, you know how dogs are, they drool and then, no? So, yung mga infected na substances or fluids from these animals can actually be, you know, that's where the virus can be found. So if
okay.
you get that on your skin, on an open wound, then you get infected.
Okay.
You have a risk of getting the virus.
Now, Dr. Jen, what are some of the early warning signs of this disease? Of course, ayaw nating umabot doon, but how long does it take for these symptoms of rabies to start appearing?
The symptoms are usually due to hyperactivity of the nervous system. So pwedeng nahihirapan silang lumunok. So there's a lot of, minsan may drooling, nahihirapan mag-drink ng water. Ayaw nila sa tubig. Not because takot sa tubig, but because they have difficulty swallowing water. They may have jitteriness or nanginginig sila. And then they can have behavioral changes. So these are the signs and symptoms of rabies, primarily because the nervous system is affected. Pero initially, the earliest signs, pwedeng mag-manifest siya as like any viral illness. So parang flu lang siya.
Kapag umabot dito sa neurological symptoms, nagagamot po ba ang rabies kapag umabot dito?
When it has reached the brain, it will have a 100% case fatality rate. This means that mamamatay talaga kapag ang isang tao kapag merong simptomas ng rabies. So talagang kinakailangan, one has to go to the hospital for post-exposure prophylaxis. Ang ibig sabihin, kailangan mabigay yung medicine that can neutralize the virus and be given the vaccination that will actively work against the virus. The recommendation is that the sooner that you get the immunization against rabies, and that means the passive and the active immunization, the better.
Once you have neurological symptoms, if these symptoms appear, there is no effective treatment, unfortunately. This is why preventing these symptoms to reach that point is the best cure. More on this when we return. You're watching MedTalk Health Talk, your partner in healthcare. The number of rabies cases increases every year. It's a virus that affects the nervous system and is very fatal. But preventing the disease is somewhat easy. Today, we'll talk about what you need to do to protect yourself from rabies. I'm Dr. Freddy Gomez. Welcome back to MedTalk Health Talk. We've established that people usually contract rabies through a bite of a rabid animal, an animal that is infected with rabies. We can also get it through scratches, abrasions, or even open wounds that were exposed to the animal's saliva. Dr. Jen, what if I was bitten by a rabid animal but there are no wounds? Should I still have myself checked?
From the outset, you don't know if the animal is rabid or not. An animal who is exhibiting behavioral changes most likely is rabid. An animal who is not exhibiting behavioral changes might also still have the virus but hindi pa nasa brain yung virus. So whether rabid or not, you should get yourself checked. And you should get the vaccination. It is also recommended to observe the animal for about 10 days if there will be any behavioral changes. So usually, kung walang behavioral change yung animal, when it bites you, pwede kasing nagre-replicate pa lang yung virus inside the animal and it has not yet reached the brain. Pero nasa saliva na ng animal. So you wait for about 10 days because it takes about 10 days for the virus to reach the animal's brain. So usually by the 10th day, mamamatay sila.
Dr. Camille, another common question is, how about if I was scratched by an animal infected with rabies but it did not break my skin, walang dugong lumabas?
So if the advice is meron kang exposure, regardless, wala kang nakitang sugat, punta ka pa rin sa ospital. What more kung meron kang scratch, no? These are obvious, breaks in the skin. When you say scratch, may hapde, no? And even if wala tayong makita, no, hindi nag-bleed, no? So it's not that deep enough, but still, because you may be exposed, then it's best to go to the hospital na lang for prevention. For animals kasi, they're not born with rabies. So it's also a disease for them. They either interact with a rabid animal. It doesn't have to be, cat interacting with another cat. It can be being one room with a bat, no, that can be potentially a carrier for rabies. It's best really to be responsible pet owners if you decide to own a cat or a dog, no, to either keep them indoors. If you don't have the luxury naman of keeping them indoors, then make sure that they're not exposed to other animals that, might be exposed also to other animals who are infected with rabies.
Okay.
And ang rabies vaccine for animals are given yearly. Para po siyang flu vaccine natin, no? I think sa Pilipinas, it's around 250 pesos per shot. But sa barangay po, libre po yan, no? Just contact your LGU. They can provide a schedule. If you have a lot of pets at home and you can't possibly bring all the pets to the barangay hall, then maybe you can request for a personnel from the barangay to come and, give your pets a shot.
Now, Dr. Jen, I'd like to go with the next procedure of someone who is bitten at pumunta na sa hospital. What should be done next?
Kailangan mabigyan siya ng post-exposure prophylaxis. And this is there are two kinds, no? One is the immune globulin. The purpose of immune globulin is to provide passive immunization. So it's 4-dose vaccine given over 2 weeks. This will neutralize the virus para hindi siya magre-replicate at hindi dadami yung virus, no? At hindi naaakyat papunta sa nervous system.
Now, Dr. Camille, is the passive and active forms of immunity given at the same time?
So it depends on your exposure category. We categorize yung type ng sugat mo from your exposure para malaman natin kung anong klaseng vaccines ang pwedeng ibigay sa'yo, no? Or yung immediately kailangan mo. So, category 1 is licks on closed skin, no? Na dilaan ka ng alaga mo, ganyan. Usually, pagka ganon, hindi kailangan ng bakuna. We encourage lang, i-wash mo buti, maligo ka, no? Hugasan mo yung parte na nadilaan, ganyan. If, however, dinilaan ka sa muka, and then pumasok yung laway ng pet mo sa bibig mo, then we recommend that you go for a rabies shot. Pag naman sinabing category 2, meron pong break sa skin. Meron kang galos, meron kang scratch, no? Na pwedeng pamasukan ng virus. So pagka ganun po, nire-recommend namin yung rabies vaccine. Pasok sa category 3. Ito po yung talagang nilapakan ng animal, no? Meron kang big laceration from the dog bite. Talagang sugat, nagdudugo. Automatic category 3 po yun. Other wounds or other exposures na category 3, kahit scratch po, pero nasa neck and up, ibig sabihin napakalapit sa utak natin, no? Napakabilis ng pwedeng travel ng virus to the brain, then that's considered category 3. Or sa mga areas na highly innervated, ibig sabihin madaming nerves kasi tandaan po natin, ang goal ng virus na rabies ay makarating sa utak, no? So, pwedeng ang channel nila ay yung mga nerves natin. So, pag nakagat ka sa kamay, ayun, highly vascularized yung area na yan, sa kilikili, or yun nga, from neck up, category 3 yan automatically. Any lick, wala kang sugat, pero pumasok yung laway ng aso sa bibig mo, then category 3 yan. So, pagka ganon, kailangan 2 klase ang ibibigay sa'yo. Yung rabies vaccine, which will give you active immune response, and yung H-rig or E-rig, depende kung anong meron dun sa emergency room ninyo, no? Or dun sa animal bite center.
Now, seeking medical attention after being bitten or scratched by a rabid animal can prevent rabies. But there are also several precautions you can take to protect your pets from infection. More on this when we return. Your health is our mission here on MedTalk Health Talk. Rabies is a primary health concern in our country, but together we can work towards eradicating it and keep ourselves and our furry friends safe and happy. Let's discuss how we can do that. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. There are several things that you can do to protect your pet from rabies. Dr. Jen, can you walk us through some of them? How can our viewers be more protected with their pets?
The important thing in preventing rabies among dogs is to vaccinate them. Dogs who get exposed to other dogs and other wildlife are more prone. So yung mga stray dogs, yung mga aso at pusa na nasa kalye, mas maganda kung ang community merong program talaga para sa vaccination. Nabanggit ni Dr. Camille kanina, marami ng projects naman sa LGU to vaccinate at the barangay level. So please bring not only your pets, but I hope your entire community will also make it a program na kahit yung mga strays sa community will get vaccinated. It's also important to limit the interaction of our pets and of animals, not with other animals who might also carry the virus. Kasi maraming strains ang virus. So merong canine strain, merong feline strain, yung strain para sa cats. No? Sometimes, pwedeng mag-cross siya. No? So pwedeng yung dog ko magkaroon ng, pag na-expose sa cats, pwedeng magkaroon ng rabies virus na galing sa cats. So kahit na may vaccine siya, pwedeng may dinadala din siyang virus. So you have to limit that also. Sana hindi natin palabasin yung mga pets natin nang walang appropriate supervision. So leash your pets when you're walking them.
Dr. Jen, you mentioned na marami palang strains ang rabies. Meron one specific for dogs and cats. Are all of these fatal? And are all of these strains addressed also by the treatments, the vaccines, and the immunoglobulin?
Fortunately, they are. Even bats, meron. Nabanggit ni Dr. Camille kanina. And outside the Philippines, I think in the West, yung bats talaga yung primary means of transmitting virus to men. Hindi ka sa dogs. Kasi maganda ang vaccination rate nila among dogs.
Now, Dr. Camille, one of the best ways to prevent rabies is to limit your exposure to this. But unfortunately, a lot of people who are working around animals, dog trainers, or probably pet stores for that matter, or people who are exposed to different animals most of their time, what kind of protection can we give for them?
Kailangan naka-protective equipment din sila like gloves, yung simple protection na ganyan. Goggles, kasi you never know, pag dogs, they start barking, yung spit, can end up in their faces, ganyan. So, of course, mask, just to limit the exposure. So, yun yung mga para sa ating animal health workers, who deal with these animals or potentially rabid. Also, just a note, for people, kasi nauso yung glamping or camping, ganyan. If you see a wild animal that appears to be tame, suspect mo na medyo, kasi they're not supposed to be behaving that way. Usually, animals in the wild, they tend to, shun away from people, especially kung maingay, kung ano. But if you see an animal there na parang it might be sick. So just stay away from strays, stay away from, wild animals like that. So yon, just to prevent your exposure.
Dr. Jen, are there any red flags on the behaviors of animal that may prompt someone to maybe think that this animal might be infected with rabies?
The virus attacks the nervous system, so you have to observe the animal very closely. The symptoms or the signs are actually quite similar to the signs and symptoms in men. So, excessive salivation, yung talagang naglalaway sila. Sometimes they have this very, among dogs, yung very high-pitched na yell or barking kasi nga their throat muscles can be weak or paralyzed. So, the way they bark sounds quite different. Sometimes they tend to be very aggressive because they display behavioral changes. So yung behavioral changes can be something like mukha silang tame when they should be wild, or sometimes they become really aggressive and they attack you without any reason.
Always remember to practice responsible pet ownership to keep your pets and those around you safe and well. Thank you very much, neurologist Dr. Jennifer Manzano and emergency medicine specialist Dr. Camille Macalalag Santa Cruz for being with us today and sharing your knowledge, especially when it comes to rabies. I'm Dr. Freddy Gomez, and thank you for watching MedTalk Health Talk on CNN Philippines. We'll see you again next time.